Chapter 1, History of Medicine and Pharmacy. So we'll skip over the terms and definitions because we'll cover them through the chapter. So we start off this chapter with important people to medication and pharmacy in general. I do have Alexander Fleming highlighted. They discovered penicillin. It was the first antibiotic. So that's kind of interest to us. So medicine has been practiced for thousands of years. Archaeological discoveries have unearthed civilizations that have documented the use of minerals, animals, and plant parts to heal the sick. Certain remedies, such as the use of herbs, have been used consistently throughout history. For example, herbs have been used for centuries for minor ailments, such as intestinal problems, arthritis, and gout. Many ancient treatments for illness were based on the dreams or vision of the believers. A dogma such as God's being able to both cause and cure illnesses is based on a set of principles proposed by authoritarians. To rid a person of an evil spirit, a cut was made into the skull to give the spirit a portal through which to leave. The type of treatment was called trifling and often was performed by a tribal shaman, which is a person that is spiritual in a tribe who cares for the spiritual, medicinal, and physical health of the tribe. They were able to communicate with spirits, and they were thought to help render the evil spirits harmless through the use of prayer, herbs, or potions. The staff of Asclepius is a formal symbol of medicine and used with Asclepius, the Greek god associated with healing. It is a wingless walking stick with a single turpent wrapped around it. Because snakes shed their skin, the stink is believed to signify renewal of youth. The caduceus is often mistakenly used as a symbol of medicine. That is the staff of Hermes, a Greek god. Right. So as you can imagine, the early path of medicine was not a smooth road. Throughout the ages, many plagues killed thousands of people. The existence of microbes unseen by the eye was not known to be responsible for many of the diseases that caused death and despair. Despite advances made through early history, most remedies for physical ailments tended to be extreme. Other ancient remedies have been used for hundreds of years. Hippocrates was born on the small island of Kos near Greece. He was a third generation physician. He taught at a school of medicine on Kos, which was one of the first medical schools established. He believed in the prevailing concept of that area. Life consisted of a balance of four elements that were linked to the qualities of good health. These four qualities were wet, dry, hot, and cold. In addition, he believed that illness resulted from an imbalance of the four humors of the body system: blood, phlegm, yellow bile, and black bile. These four humors were linked to the four basic elements. Blood is air, phlegm is water, yellow bile is fire, and black bile is earth. Methods used to treat imbalance of the humors included bloodletting and natural laxatives. Hippocrates was responsible for many advances in the world of medicine. Some of his observations included the effects of food, climate, and other influences on illness. He was one of the first physicians to record his patients' medical illnesses. So first person to chart information, kind of using that medical record. Today, medical schools still use the Hippocratic oath as part of the graduation ceremony. And we have that modern version here in box 1.1. Later in history, the Greek philosopher and scientist Aristotle was responsible for many advances in the area of biology and medicine. His main area of interest was biology and the study and classification of various organisms. He classified human beings as animals because the Grecian belief system in those times did not allow dissection of the head. He described much of human anatomy from observations he made from dissections of other animals. This included in-depth descriptions of the brain, heart, lungs, and blood vessels. Claudius Galen began to study medicine at the age of 16. He attended medical schools in Greece and the famous Alexandria School of Medicine in Egypt. The philosopher and alchemist Roger Bacon further refined and explained the importance of experimental methods, which focused on observation, hypothesis, experimentation, and verification. Paracelsus was a Swiss physician and alchemist, believed that it was important to treat illness with one medication at a time. And table 1.1 shows advances in medicine, and it has the year, so it's kind of interesting. We're starting all the way back in 1628 with William Harvey. He writes the first book on blood circulation through the heart. 1747, we have James Lind, who discovers that citrus fruits prevent scurvy. So we have quite a few other ones. 1816, the stethoscope was invented. In 1818, the first blood transfusion was performed. In 1842, Crawford Long used ether as a general anesthetic. 1870s, we had the establishment of germ theory of disease by Louis Pasteur. So that's where we get the process for milk pasteurizing. That's where that came from. In 1895, we had William Rankin in the discovery of X-rays. Felix Hoffman in 1899 develops aspirin. Let's skip down to some others. So we have Edward Mellanby, who used insulin to treat diabetes first in 1922. We talked about Alexander Fleming. He discovered penicillin in 1928. In 1932, sulfonamines were discovered by Gerhard Domagek. Hopefully I'm saying that right. And we have some more recent dates, such as 2007. Scientists discovered how to use human skin cells to create embryonic stem cells at a university, at the University of Wisconsin. First full-face transplant was in 2008. In 2013, we had the first baby cured of HIV in the United States. And in 2013, we produced the first kidney grown in vitro in the United States. And that was researchers at Massachusetts General Hospital in Boston. Over the millennia, some prevalent treatments consisted of multiple mixtures of plants, roots, and other concoction. Digestion of the type of plant that resembled the organ affected by disease was also believed to cure illnesses. So, for example, those with liver problems ingested a plant called liverwort. And other popular treatments were using garlic for inflammation of the bronchial tubes, wine and pepper for various stomach ailments, onions for worms, tiger fat for joint pain. From the time of Galen, it was widely believed that four humors could be rebalanced through the use of cathartics to clean out the bowels, diuretics to lessen the imbalance of body fluids, emetics to empty the stomach, and bloodletting to lessen blood fluids, heart rate, and temperature. Physicians brought this theory to America, where such techniques are widely used, especially bloodletting. Bloodletting had its origins in Egypt more than 3,000 years ago and later spread into all areas of Europe through the Middle Ages. Just as trephination of the skull was believed to release evil spirits, bloodletting was thought to be an effective way of lessening excess blood fluids that were believed to cause illness. Artifacts such as sharp bones, shark's teeth, thorns, and sharpened sticks were believed to be the earliest instruments that were used in bloodletting. And in the 19th century, some even believe that bloodletting was a good preventative measure to use for good health. A well-known victim of bloodletting in America during the 18th century was George Washington, who suffered from an infection and died of complications from bloodletting. At that time, it was wrongly believed that the body contained 12 quarts of blood. However, it contains only 6 quarts. And President Washington was bled of 4 quarts over a 24-hour period. One bloodletting treatment involves using leeches. These blood-sucking worms were gathered, stored, and used to remove blood from patients. The leech has an ability to latch onto the skin with sharp teeth-like appendages and engorge itself to nearly twice its size on the person's blood. Leeches were used in specific places, such as the vagina, to treat amenorrhea, which is the period. So medicine did advance through the 19th century. Medical schools arose in Europe, specifically in France and Germany. Many of the doctors trained in these schools came to America and brought with them this European influence in medicine. Medicinal recipes were written in Latin until the 1900s. So box 1.2 presents an example of a commonly compounded prescription. Because Latin was used in medicine and apothecary products, this order could be interpreted by most practitioners, so kind of worldwide. So here is a example from the 1900s. Throughout the 19th century, the church became active in scientific research as well. A monk named Gregor Mendel experimented on plants and noticed that changes from generation to generation with respect to color, size, and appearance. He used pea plants to determine how traits were transferred from one to another, and in doing so, determine the basics of genetics. In 1822, he determined how stronger plants could be propagated through heredity. It was not until the 1900s, however, that other scientists were able to continue his work and enlighten the scientific world with the theory of genetics. As a result of his work, Mendel became known as the father of genetics. Florence Nightingale was born in Florence, Italy in 1820 and is best known as a nurse who spent her career caring for the wounded. She believed in cleanliness and its benefits to the medical field. She started a hospital and founded a school for nurses, and her writings sparked worldwide healthcare reform. The first pharmacists were known as druggists, and at that time they were doctors until pharmacy became a specialty. The term druggist was widely used from the 1700s until the mid 1800s to describe the practitioners of pharmacy, eventually leading to the title pharmacist. Remedies used in early American history include konosha bark, which is quinine, for the treatment of malaria. More unconventional and dangerous treatments were also used. For example, mercury was used to treat syphilis. Most people died of mercury poisoning because of its toxicity, and many people also died of typhoid fever, malaria, diphtheria, and dysentery. The need for doctors and treatments increased dramatically. The average expectancy was approximately 40 years old, and many families lost children to childhood diseases such as smallpox, for which no vaccines were available at that time. Most treatments were concoctions handed down through family tradition, and if a person were to use a doctor, he or she most likely would be treated at home or in the doctor's office, with treatments ranging from minor procedures to surgery. Box 1.3 shows typical remedies during the 1800s in America. So to stop earaches, blow tobacco smoke into the ear. You can read through the rest of them. For eye infections, add mercury to other ingredients such as eye drops. Just a little tech note, vaccines did not develop until 1796 with the first immunization against smallpox in England. The smallpox vaccination was stopped in 1971 because the disease had been eradicated worldwide. One of the most popular tonics made for medicinal use in early America contained opium and alcohol. Its effectiveness was surpassed only by its addictiveness. This tonic was given as a sedative and to dull the sensation of pain. Paracelsus introduced the opium alcohol mixture, which was called laudanum, and it was used as a medicinal remedy in the 16th century. It was widely used throughout Europe in the Victorian era. And in the Civil War, it was used to treat painful wounds from the battlefield. And it was also used by white middle to upper class women for a host of problems, including nervousness, diabetes, diarrhea, gastric problems, menstrual pain, and even morning sickness. It was also used to calm screaming babies. And as you can imagine, individuals became addicted at an alarming rate. Many mortalities and miscarriages were attributed to this agent. Even though it was well known by the 18th century that opium and alcohol were addictive, alternative remedies were hard to find. So we have the recipe for laudanum in box 1.5 from 1669. 16 ounces of sherry wine, 2 ounces of opium, 1 ounce of saffron, 1 ounce of powder of cinnamon, and 1 ounce powder of cloves. Opium has a long history in the medicinal relief of pain and in recreational use. Opium is a byproduct of the plant commonly known as the opium poppy. Although opiate was a term used for a drug derived from opium, the more common term is opioid, which refers to both synthetic and semi-synthetic medications. Opioids and opiates react on the same opioid receptor sites, which are located in the central nervous system and gastrointestinal tract. The effects associated with the opioid receptors include analgesia, respiratory depression, pupil constriction, reduced gastrointestinal motility, euphoria, dysphoria, sedation, and physical dependence. Opioids and opiates have many of the same side effects, including nausea and vomiting. When used properly, the opioid drugs are effective and help many patients who otherwise would suffer extreme pain. Not until 1909, under the Opium Exclusion Act, did the prohibition of opium importation begin in the United States. Alexander Fleming accidentally contaminated a plate of bacteria with mold while working in his laboratory in 1928. So we talked about him at the beginning of this chapter. He was a Scottish physician and bacteriologist. The mold then inhibited the growth of the bacteria, and he named the mold penicillin. Many years of failed and successful experimentation by many scientists followed before penicillin was recognized as a useful medicine. It was not until after 1938 that penicillin would undergo mass production and be used worldwide as a helpful antibiotic. It was the first antibiotic discovered, and it is still in use today. The first synthetic drug, a sulfonamide, was discovered by Gerhard Domak in 1938 and was derived from a chemical dye found to inhibit bacterial growth. This sulfonamide was also used extensively during World War II to treat infections that were a result of battle wounds. Today, sulfonamides are primarily used to treat urinary tract infections. Many antibiotics were discovered in the years after penicillin and sulfa. Also in the 20th century, a very important discovery was made by James Watson and Francis Crick. In April 1953, they published a scientific paper presenting the structure of the DNA helix, the molecule that carries genetic information from one generation to another. They ultimately received the Nobel Prize in Physiology or Medicine, along with Maurice Wilkins, for their important contributions to science. Louis Pasteur, who is best known for the pasteurization process, was also responsible for discovering vaccines such as the anthrax vaccine. Table 1.2 shows examples of important vaccine advances in medicine. So you can see there's quite a few going all the way back to 1796 for the smallpox vaccine. And we have all of our vaccines here leading us up to 2016, which was when the cholera vaccine came out. So just keep in mind, this book is a little old, so of course it's not going to have any of the most recent vaccines that have hit the market, including the COVID vaccines. The U.S. Food and Drug Administration approved the use of both leeches and maggots in the medical setting in 1976. This may seem strange and not much of an advance in medicine, but the origins of this type of treatment stem from research in the repair of tissue that has been severely damaged, such as that found in patients who have undergone reconstructive surgery or skin grafts, or patients with infections. Surgical reattachment of veins can result in coagulation before blood flow is reestablished to the affected part, thus killing the affected tissues. Leeches are used to siphon excess blood from the area and prevent coagulation from taking place too soon. They are applied one at a time over 20 minutes for up to 2 days as necessary. Leeches are cared for and stored in the refrigerator in the pharmacy. Because dead skin is the main dietary intake of maggots, they can be used to remove dead skin. Antibiotics are normally used as the first course of treatment. However, when they are ineffective, physicians have used maggots to do the manual work of restoring the wound to a recoverable stage. Not only do they eat the dead tissue, they also have the ability to kill the bacteria that is the cause of the infection. Other remedies that are being studied, such as honey produced by some bees. The medicinal attributes of this type of honey include the ability to heal wounds. Manuka honey keeps the wound moist, is bacteria-free, and has a high sugar content, along with minerals, vitamins, and amino acids that may promote healing. In 2007, the FDA and Health Canada approved its use for wounds and burns. In 2010, it was approved to treat leg ulcers and diabetic foot ulcers. In 2012, it was approved for wound dressings to be sold over the counter to treat abrasions, lacerations, and minor cuts. The expanding population and the subsequent increasing need for trained medical professionals influence the need for specialists such as veterinarians, eye doctors, and pharmacists. As the physician's role is changing from distributing drugs to diagnosing disease and performing surgery, the role of the pharmacist emerged. The first pharmacy school opened in 1821 at the College of Pharmacy and Sciences in Philadelphia. The school is now called the University of the Sciences in Philadelphia. Through the 1800s, pharmacists compounded nearly every drug ordered by physicians. Various sizes of ornate apothecary jars were used to store herbs and ingredients. The instructions for preparing remedies were contained in medical recipe books. Ingredients such as chalk for heartburn, rose petals for headaches, and oils, herbs, and spices filled containers in the apothecary. Although many of the ingredients in early compounded remedies are no longer used, several are still in use today, such as aspirin, digoxin, and others. Another type of interesting container associated with the pharmacy was the show globe. Show globes have been the beacons for pharmacies dating back as far as the early 1600s. It is believed that they were placed in the apothecary stores of the town to let visitors know the status of the health of the town. So here they are. Here, there's a blue one and a red one. Red meant that there was illness or that the town was in quarantine because of disease, whereas green meant the town was healthy and thus it was safe to come into town. It also said that signs are posted on the doors of the contagious individuals rather than relying on the globes. So I guess this is supposed to be the green one. Kind of looks blue there. The first pharmacy managed by a registered pharmacist opened in New Orleans in 1823. Starting in the mid 1800s and early 1900s, the soda fountain became an extension of the town drugstore. The first soda fountain pharmacy began in the mid 1800s and gained its popularity in the early 1900s. Prohibition in 1919 also helped with the proliferation of soda fountains. With the invention by a pharmacist, Jacob Bauer, of a soda fountain that dispensed carbon dioxide, soda fountain units could easily prepare all types of carbonated drinks. Pharmacists would make and market their own recipes to be used for various treatments. It was common to find drugs mixed with flavorings along with effervescent soda water to treat ailments or provide a boost of energy. Both caffeine and cocaine were also often used in sodas. Some of the many conditions mineral water was supposed to cure were obesity, upset stomach, depression, and nervous disorders. Pharmacists sold phosphate sodas and ice cream favorites, worked the lunch counter, and filled the prescriptions for the day. The first 7-Up drink was made with lithium and was sold from soda fountains for conditions such as gout, uremia, and rheumatism. In 1886, Coca-Cola was invented by John Pemberton, a pharmacist in Georgia. The soft drink was marketed as a tonic and contained extracts of cocaine and caffeine until 1905, when cocaine was removed from the recipe because of changing public opinion regarding its use. It was not until later, after the Harrison Narcotic Drug Act of 1914, that pharmacists were prohibited from making cocaine-containing preparations and began to sell plain soda drinks. Box 1.6 has famous pharmacists. So Charles Alderton, who invented Dr. Pepper, Caleb Branham, who invented Pepsi, Susan Hayworth, the first woman to graduate from the Philadelphia School of Pharmacy. Charles Hires invented Hires root beer. John Pemberton invented Coca-Cola. William Proctor, the father of American pharmacy. Ella Stewart, one of the first African-American female pharmacists in the United States. And James Verner invented Verner's. And Harvey Whitney, founder and first president of the American Society of Hospital Pharmacists in 1942. The first pharmacy technicians were those enlisted in the military because of the high demand for medications to treat injuries and illnesses. These individuals were trained on the job not only to fill prescriptions, but also to perform many of the functions of a pharmacist. To this day, military technicians have a broader scope of training than civilian technicians. Technicians also were employed by pharmacists who owned drugstores. Family members helped behind the counters. An urgent need for standardized training arose in the 1960s as pharmacist organizations such as the American Society of Health System Pharmacists, the Michigan Pharmacists Association, and the American Pharmacists Association realized that technicians would be able to better serve the patient with additional training. Technicians play such an important role in the healthcare of patients that it is important for them to understand all aspects of the required tasks in the pharmacy. In 1995, the PTCB, the Pharmacy Technician Certification Board, was formed, which was responsible for creating a national examination for technicians. Although the transition from clerk to technician is fairly recent in history, forecasts indicate that the pharmacy technician will play a critical role in the future pharmacy setting. New job positions are constantly being created for technicians who have necessary skills and knowledge to fill them. Clinical technicians now assist the pharmacist with a variety of tasks, such as anticoagulation monitoring. They may also manage the automation and pharmacy coordination systems in certain pharmacies. Table 1.3 lists advances in the field of pharmacy technology. So in 1979, I have highlighted that the American Association of Pharmacy Technicians was formed. We have other ones that you should read through. This is going all the way up until 2015. So quite a bit information about pharmacy there. So technicians were once viewed as incompetent in many areas of pharmacy, but nonetheless a threat to replace pharmacists with cheap labor. Views now have changed because even with the increase in technicians in the workplace, pharmacists still are in high demand. Technicians are now part of the healthcare team, and most pharmacists are confident they can delegate tasks to technicians, knowing that the job will be done correctly. Times have changed, and so have the requirements of today's pharmacists. For licensure, most states now require pharmacists to obtain a Doctor of Pharmacy degree, a PharmD. College students can start a 4-year pharmacy program after successfully completing 2 to 4 years of undergraduate coursework and earning a passing score on the Pharmacy College Admissions Test, the PCAT. Coursework usually includes biology, chemistry, anatomy, and physics. Additionally, PharmD students must complete rotations in a variety of clinical and pharmaceutical settings. Pharmacists who received a Bachelor of Science in Pharmacy before the change have been allowed to work in pharmacy without. Today's typical pharmacy technician is required to do an array of tasks, all of which require competencies in many areas. Therefore, in some states, technicians are required to complete additional education as well as on-the-job training. Currently, there are no nationally standardized requirements for pharmacy technicians. Technicians assist the pharmacist in community settings by entering and maintaining patient medications and history, preparing prescriptions, management of inventory and third-party billing, and compounding specialized medications. In an institutional setting, which includes hospital and other types of inpatient pharmacies, tasks include supplying floor stock, preparing parenteral medications, transcribing physicians' orders, and managing inventory for automated dispensing cabinets. Other practice areas such as long-term care, nuclear, and insurance or call centers require technicians to be trained in specialty areas. In all pharmacy settings, technicians require strong communication and organizational skills. Entry-level pharmacy technicians must possess skills in pharmacology, laws and regulations, compounding, medication safety, inventory and billing, and technology. They can also obtain specialty certifications and may participate in providing specialty services. Over the decades, the pharmacist has become known as a person who can be trusted to provide truthful information, someone in whom a person can be comfortable confiding in. Although some traditions continue, times have changed concerning the role of the pharmacist. The most prevalent change can be seen in the inpatient setting of the hospital. As the competency of a pharmacist has become more clinical and involved in the patient's overall well-being and health, pharmacists are becoming more involved alongside physicians in the appropriate prescribing of medications and their dosages. These clinical pharmacists are found in the community pharmacy and in hospital settings. Another important change in pharmacy concerns the laws governing patient consultation. The Omnibus Budget Reconciliation Act of 1990, OBRA 90, addressed several issues concerning patient education and monitoring of medications. Thousands of technicians help lighten the load of filling prescriptions and performing other non-discretionary tasks. Therefore, it is important for the patient to be able to trust a technician to provide the best care by filling the correct medication and referring the patient to the pharmacist for appropriate counseling. Technicians' duties continue to expand and change. In some pharmacies, technicians regularly enter prescription orders into the computer. This task was previously done by a pharmacist. The pharmacist is moving into a more highly clinical role, not only counseling patients, but also working with the medical staff. To a degree, the technician now does what the traditional pharmacist did, a health professional who transcribed orders, pulled medications, and filled prescriptions.